Hello and welcome. Today we're diving into the complexities of Fragile X syndrome, a genetic condition that impacts cognitive development and overall health. We'll explore its causes, effects, diagnosis, and management, providing a comprehensive overview of this important neurological disorder. Fragile X syndrome stems from a mutation in the FMR1 gene, located on the X chromosome. This gene is responsible for producing a protein called FMRP, or Fragile X mental retardation protein. Think of FMRP as a crucial building block for brain development and function. The mutation involves a repeated sequence of DNA, specifically CGG. In individuals without Fragile X, this sequence repeats between 5 and 40 times. However, in those with the syndrome, the repeat can occur hundreds or even thousands of times, essentially silencing the FMR1 gene and preventing the production of FMRP. Without FMRP, the brain struggles to develop and function normally. FMRP plays a vital role in regulating the production of other proteins at the synapses, those crucial connections between nerve cells. It's also involved in synaptic plasticity, the brain's ability to adapt and change over time. The absence of FMRP leads to an overabundance of certain proteins and disruptions in synaptic function. This overstimulation and inefficient communication between neurons are believed to be the root cause of many of the cognitive and behavioral challenges associated with Fragile X syndrome. The brain's neural circuits, responsible for processing information and controlling behavior, are significantly affected. Fragile X syndrome is the most common known single gene cause of inherited intellectual disability and the most common genetic cause of autism spectrum disorder. It affects individuals of all ethnic backgrounds. While it affects both males and females, males tend to experience more severe symptoms because they only have one X chromosome. Females, with two X chromosomes, often have one functioning copy of the FMR1 gene, which can partially compensate for the mutated copy. Estimates suggest that approximately 1 in 4,000 males and 1 in 8,000 females are affected by Fragile X syndrome. The signs and symptoms of Fragile X syndrome can vary significantly in severity. Common features include intellectual disability, ranging from mild learning difficulties to more significant cognitive impairment. Developmental delays in speech and language are also frequently observed. Behaviorally, individuals may exhibit hyperactivity, impulsivity, attention deficits, anxiety, and autistic-like behaviors such as hand flapping and social difficulties. Physical characteristics can include a long face, large ears, prominent jaw, and in males, enlarged testicles, macroorchidism after puberty. However, not everyone with Fragile X syndrome displays all of these physical traits. Some individuals may only present with subtle learning or behavioral challenges. Diagnosis of Fragile X syndrome is primarily achieved through a DNA test that analyzes the number of CGG repeats in the FMR1 gene. This test can accurately identify individuals with a full mutation, leading to the syndrome, and those with a premutation, a smaller number of repeats that doesn't cause the syndrome but can lead to other health problems, and can expand to a full mutation in future generations. Carrier screening is recommended for women with a family history of intellectual disability or unexplained developmental delays. Genetic counseling is essential to help families understand the inheritance pattern and risks associated with Fragile X syndrome. While Fragile X syndrome doesn't have distinct classifications or types in the same way some other conditions do, it's important to understand the different genetic states related to the FMR1 gene. We've already discussed the full mutation, which causes Fragile X syndrome. There's also the premutation which, as mentioned earlier, does not cause Fragile X syndrome itself but can lead to Fragile X-associated trim or ataxia syndrome affects TESS. In older males and Fragile X-associated primary ovarian insufficiency affects POI in females. A gray zone or intermediate range also exists, where the number of CGG repeats is slightly elevated but not enough to be considered a premutation. The stability of these intermediate repeats across generations is unpredictable. Currently, there is no cure for Fragile X syndrome. However, a variety of treatments and therapies can help manage the symptoms and improve the quality of life for individuals affected. These may include early intervention programs. These programs, started in infancy or early childhood, focus on developing cognitive communication and social skills. Speech therapy to address language delays and improve communication abilities. Occupational therapy to enhance fine motor skills, sensory processing, and daily living skills. Behavioral therapy to manage behavioral challenges such as hyperactivity, impulsivity, and anxiety. Medication. Certain medications may be prescribed to address specific symptoms, such as ADHD, anxiety, or depression. Educational support. Individualized education plans can help children with Fragile X syndrome succeed in school. Because Fragile X syndrome is a genetic condition, it is not preventable in the traditional sense. However, genetic counseling and carrier screening can help individuals and families understand their risk of having a child with Fragile X syndrome. If a woman is found to be a carrier of the premutation, she can discuss her reproductive options with a genetic counselor, including preimplantation genetic diagnosis, PGD, or prenatal testing. The prognosis for individuals with Fragile X syndrome varies widely depending on the severity of the condition and the effectiveness of early intervention and ongoing support. With appropriate therapies and support, individuals with Fragile X syndrome can achieve significant gains in their cognitive, social, and adaptive skills, leading to a more fulfilling life. Recent research is focusing on developing targeted therapies that address the underlying biological mechanisms of Fragile X syndrome. One promising area is the development of drugs that can modulate synaptic function and restore normal brain activity. Clinical trials are underway to evaluate the safety and efficacy of these novel treatments, offering hope for improved outcomes in the future. Thank you for joining us as we explored Fragile X syndrome. By understanding this condition, we can help support those affected and contribute to advancements in research and treatment.